everyone, I'm really keen to show you my setup for a full arch case, because a lot of time I'm coming to the practices and I think it's so important if I can share with you exactly how I have it set up in my clinic in Edinburgh. So here's my clinic. So I'm very fortunate, I've got a really big room, spacious, and that's just luck. But it's useful because often I have a lot of people in the room. Sometimes there's people watching, there's extra nursing staff, there's equipment around the patient, and it's nice to have a big room. So if you're in a practice and you have a choice, try to go for the biggest room. And the setup is so important because the preparation for doing this type of surgery is crucial, and it really does help you get a successful outcome. So come on in, and I just want to show you everything I've got in the room, and it's all set up for us to go with the surgery. So first of all, please make sure you have the patient's imaging, radiograph, OPT up, and relevant markings. So that is really important because when you're doing the surgery, sometimes obviously you've visually prepped in your head exactly what you're going to do, but it's good to have this up at the same time, just for quick reference, because you know, at the heat of the moment, we often sometimes forget what we thought about before. Then if you come this way, this is great. This is a really neat thing. It's a wipeable, disposable whiteboard, and you get it from Amazon, and we'll share the link with you. And here I put all the information. So the heat of the moment, we've got the patient's name. So look, this is a John Doe. So patient, I like to put exactly what we're doing. I like to put the start time, the amount of local I've given, the amount of sutures, because we've got to count the sharps, the amount of blades, the amount of needles, and then we can check at the end that we've got them all and the nursing staff know exactly. Patient's medical history, if they've got any allergies, can we have that up on? So it's quick reference. Patient's age, I think that's really important, and exactly what you're doing. Then often here, I'll write exactly what size of implants I'm putting on, and then I will also then get my team to put on the multi-units here. So what multi-units I used, so typically 30 degrees at the back here. So I'll write that on as well. And then at the end, you can just take a quick picture of that and put it in the notes, and it's great. Okay, and then also, if there's anything else that you may want to put up, like the team members present, I sometimes have the names of the different team members present. And it's especially useful when I'm working in different practices, because often I've never met the patient before and I don't know all the staff. And if I have their names up there, it's really easy for me just to remember, oh, that's Jane, or that's Jennifer, etc. Right, so come this way. Often for the full arch cases, I'm doing sedation. So I've got a Dynamat V100. This is really useful. It's on wheels. You can roll it in between surgeries, which is really useful. And it's really neat to have rather than, the small finger ones are really not good enough. But this is all in one. It does the pulse, the O2, and the blood pressure. And then the patient would be here, obviously. We've got a full drape. The patient's got a hairnet, and that's really important. I use these foamies that are great for eye protection. They are brilliant. They don't fall about. You can go like that, jump up and down, and it's fine. So these are foamies, and a big reference to Ash in Newcastle, because he's the one who told me about these. So these are really useful, so I'll keep them on now. So this is a patient's drape. This is a great thing that goes on the patient once you drape them up to put your instruments on, etc. And then we always should look to, we like to use one of these suction pipes, and then we attach the suction pipe onto the patient's drape, and that's useful. And then, I'll take it off now. And then here, I always have the local, I always give the local non-sterile. So plenty of local anaesthetic, and typically I'm using Artane. So we've got loads of local anaesthetic here. We've got the needles, we've got some topical pre-op meds for the patient, painkillers and antibiotics. I always like to give painkillers and antibiotics beforehand. And then they've got a pre-op mouth rinse. Yep, it's Corsidol, so Corsidol pre-op mouth rinse, and you give them a face swab of Corsidol as well. So if you follow me, and this is the patient's take-home bag with painkillers, instructions, swabs, ice packs, etc. And it's always really useful, obviously, big surgery, to give the patient a take-home pack. So if you come over here, you'll always need some visors. I typically don't like to wear a visor, etc. But when I'm doing an alveoplasty, I'll insist on wearing a visor because there's often a lot of water spray and bone spray. So visors are really handy. Please, 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 can we make sure that we're using Hippie Scrub for disinfection of our hands prior to gowning up? And so we've got hats, sterile hand towels, drapes, and the gloves here as well. And just over here, this is great. So this is a light cure box, and once I've done my conversion and smoothed and polished it all, I like to add a glaze. And so this is Palaseal, and you just paint it on with a paintbrush onto the denture, onto the fixed bridge, and you just pop it into here. And then this box is a light cure box, and it's got a rotating plate, and you just put that on for 4 or 5 minutes, and then it gives it a really good cure. Because this Palaseal really does need the light box to get to cure appropriately. The hand curing torches just aren't good enough. So if we come over here now, this is the surgical setup, and as you can see, I'm very fortunate. I've got a nice big uniform area where we can put all our instruments, and it's really accessible. So over here I've got my trusted surgical motor appropriately draped up, and then my handpiece. So often I'm starting off with a straight handpiece, and here you can see this is the alveoplasty burr that I do really like to use. It's a very aggressive acrylic burr, and so my assistant's kindly got that all set up and ready. And then the contra angle handpiece, and I will always need round bars. So stainless steel, 2, 3, 4, 5 millimeter round bars to degranulate the sockets if there's teeth to come out, and then to identify and mark the osteotomy sites. So these are essential in your full arch kit. Then we've got obviously a scalpel with the handle, and please make sure that you have at least 4 or 5 15C scalpels open and ready to go on your table. And then a mirror, and we need a probe, we need a periodontal probe, we've got the dissector here, we've got the boozer, we've got the obligezer, then we've got a larger periosteo elevator, which is essential, we've got a Lucas Carrette, bone rongeurs, and then needle holders, scissors, an artery forceps, tooth forceps, non-tooth forceps, osteotomy explorer, then the surgical kit for Neodent, and the restorative kit for Neodent should all be out. And then one of my favourite instruments, the Minnesota. Okay, we've got to make sure we have at least 2 or 3 Vicryls open. So typically I'm always suturing with Vicryl 4O, and I like to suture the palate or the lingual tissue with a 3O black silk. So we have that out and ready. Plenty of swabs, can't have enough. And please, can you purchase the packs that are individually packed into in 2 or 3, because if you get you can sometimes get this big roll of gauze and then you cut it, but it all frays from the sides, and then when you're putting it in the patient's mouth, and it goes into the surgical wound, and it's not ideal. So you really need to get gauze, ideally this size, and it's all nice and neat at the sides. Okay, and then please, these are essential again. 10 millimeter syringes and a drawing up needle. And the importance of the drawing up needle is obviously it's still quite sharp, but at least it's not going to sharp, sort of stab right through you. And it's great because draw up the saline, and it's quite a wide bore, and then it comes out with a good pressure just to clean the surgical field. And I can bend it slightly, and I can put it into the osteotomy at the top to flush out the osteotomy and flush out any debris, etc. And then coming over, obviously we'll need a gun to hold the various materials that we will need. We will need rubber dam, and this particular rubber dam is the best rubber dam that I found for my direct pickups. And kindly Cash has cut that into a nice U shape in preparation for the pickup. So that's great. Then I like to use this bite registration, and it's just the really cost-effective stuff from Henry Schein. This I feel works the best. And then just again, cost-effective light body, and again, this works really well. And then we always need UFI gel, and just make sure it's UFI gel hard C. That is really important, and make sure you've got enough volume for the case. And then we always need, obviously, plenty of adapters, and we need the adapters with and without the yellow tips. And then we always need the adhesive, that's really important. Micro brushes, plenty of them, and dampens dish. All right, and then various bars for the conversion. So we've got the tri-cutter, that's really important. We've got an aggressive acrylic bar to trim, and then another bar to finish off, and then polishers. Okay, good. And then here we've got the lab work. It's always soaked in some antiseptic solution. We've got the denture for conversion. Okay, and then we've got the restorative guide, and then a pencil, a surgical pencil. It's cold. It's been cold sterilized in the Corstal. Again, we'll give you a link for that, but you buy about 150 of them for under £10 on Amazon. This is great, essential for all your surgical cases. And then a retractor, full mouth retractor of some type. You can use a Mati, or this one's a bit cheaper, but it doesn't flex. Okay, Optrogate. Yeah, really important to have an Optrogate. And typically most patients are a regular size. We've got some articulating paper, a high speed just to make final adjustments with the occlusion, and then a mirror, photo mirror, and this is the photo mirror handle just to make taking some photos, which I like to do during the procedures, a bit simpler. So I think that is everything I'm been able to talk through it. And what I want to just say is it's so important that everything is out, because if things are not prepared, what you'll notice is that it just slows down the whole process. And like anything, when you do full arch implant treatment, you'll get yourself into a flow, and you want to keep that flow going. And whenever you have breaks, it disturbs your thinking and your thought process. And I feel that has an impact in the results you potentially get. So preparation is everything, and I hope this video has been useful. Have a great day.